I think last few this one only. So let me wind it off. I think maybe another 3 or 4 topics only. Hi everybody. This is Dr. Sham. I am a rheumatologist from Chennai. This is the common thing most of us we discuss diet in arthritis. Even I will be happy if there is more evidence. See, in modern medicine, whatever I speak or whatever I spoke in the previous videos is not my own this one what you call views or anything. It is about evidence. So any disease in modern medicine, trials are being done. So somebody will be given something, the other group won't be given that particular thing. Then they see the difference. Even in diet it is the same. So some patients avoid a diet, whether they do well, somebody take the diet, whether they are not doing well. That is how the trials will be done. But unfortunately in arthritis we don't have any big or very major evidence with regards to the diet. So always see, in general, whenever we go to a doctor, it's natural for the patients to expect the doctor to give a dietary advice. In diabetes we give, in hypertension we give, in heart disease we give. In arthritis, that evidence or there is not much role for diet, though sometimes patients we do feel, some people tell they take a lot of like potatoes, they do have increase in joint pain. Some people take a lot of tomatoes, they do have joint pain. So usually the thing is, what I tell is, lack of evidence doesn't mean there is no role for diet. At least as of now the scientific community doesn't have much evidence with regards to diet. So in my patients I tell, once the disease is under control, I ask them to observe whether any particular diet is worsening the disease. If it worsens, see, definitely taking too much of potatoes or tomatoes is not going to be so this one. So I tell you can avoid that. That is a practical approach than arguing whether there is an evidence for diet in arthritis or not. So going into the diet, what are the ones? See, for gout, I think in the previous video I spoke in detail. Definitely among arthritis, the only arthritis where there is a very big role for diet is gout. So there we have already told you have to avoid alcohol, sweetened beverages, non-vegetarian like seafood, red meat, all those things have to be avoided. But when we come to other arthritis like an rheumatoid arthritis or ankylosing spondylitis, rheumatoid is pretty common. So usually patients have a lot of questions. Generally, the whatever evidence we talk, whether you call it as a low inflammatory diet, you call it as a Mediterranean diet, you can give various names, but the gist is simple. And but if you really look into it, whatever our ancestors or our parents told at home, no, the same things hold good. Take lots of fruits and vegetables. You have a lot of antioxidant, anti-inflammatory property. Taking low carbohydrates, low sugars, or low starch definitely helps. Not only rheumatoid, even ankylosing spondylitis, some studies have that. So definitely we need carbohydrate, fat, protein, but all of us know, and minerals. So the protein can take, then carbohydrate should be little bit less. Fat is the one which you have to take least. So definitely low carbohydrates helps not only for gout, even for other arthritis. Definitely it helps in bringing down the inflammatory activity. Even people who are overweight, you can come down, bring down your weight. Then about omega-3 fatty acid, a lot of studies are there, but it's not that you take daily 5 fishes so you don't get a rheumatoid. So definitely trying little bit of omega-3 fatty acid either in a fish, or somebody is a vegetarian, as a cod liver oil, or walnuts are pretty good. They don't have fat. You have most of omega-3 good fat, actually fatty acid. So these things can be tried. I usually don't object. I mean, patients can, if they want to try, they can try. Taking whole grains than a polished grain, again we know is good, though the many of us may not like the taste, but still whole grains, these are all basic things. Even at in our schoolings we might have gone through. So again it helps. So taking whole grains helps. Fruits and vegetables, as I told, definitely helps. Spices and herbs, good thing. In India we use a lot of spices and herbs. See, many times now the commercial ones what we use for osteoarthritis is curcumin, which is nothing but in Tamil we call it manjal. So our spices like pepper or turmeric, all those things, they are going to definitely play a minor role. So nothing wrong in trying. Some people even ask about some spinach. In Tamil, they ask about this modakatan kirai. So anything natural, which we know, nothing wrong in trying, because we are not going to lose anything. If it is going to help, then all of us are happy, both the doctor and the patient. Then the other thing is about calcium and vitamin D. This is calcium. Somehow, for some reason, I don't know, the calcium intake is pretty poor. It's not the only this generation. Even I see elderly people trying to avoid milk and other milk products. I don't think milk is the only reason for any of us putting weight. I think there are so many other factors. So please don't avoid milk, because this is a common feedback I get. Just because they are telling milk, you will gain more weight. So take any milk product, doesn't matter whether it's a milk or curd or what is it, buttermilk, or if you're young, if you don't have any cholesterol, paneer, or you can take a lot of tofu which has protein, vitamin D. Vitamin D, usually it's not available much in the diet except for maybe egg yolk or other things. In India, we have now some of the food substances are fortified, means artificially added. Maybe in Western, it's more common. Here, now people are starting like something like how we do iodized salt. No, sometimes they do fortify some foods with vitamin D. It's not so common, but in general, for vitamin D, it's about the sunlight. So these are the general dietary advices. I think if you see, this is what our parents or ancestors tell: low carbohydrates, lot of fruits and vegetables. You can take omega-3 fatty acid, whole grains, lot of milk products, spices and herbs we always add. So this is what I will be advising for a anti-inflammatory diet, or whatever name we can keep for a patient with arthritis. So eat healthy, stay healthy. Thank you.